This is tip number 10 for adults exercising with scoliosis. A scoliosis specialist can help at any stage, and especially when you feel you are not reaching your goals or your symptoms have increased. A scoliosis specialist is a physical therapist trained in a method of scoliosis-specific exercise, which consists of three-dimensional self-correction, stabilization of the correction, and translating correction to daily activities. The specialist can provide manual therapy to reduce myofascial restrictions brought on by the scoliosis. A scoliosis specialist will assess your radiographs and imaging in order to provide a definitive diagnosis of your curve type. They will explain how the curve pattern affects your body in order to teach you specific techniques for curve correction. A specialist can identify sagittal pelvic parameters on an X-ray as a guide to help improve sagittal posture. If pelvic incidence, a static structural measure, and lumbar lordosis, a changeable postural measure, are not within 10 degrees of each other, this is a risk for pain and disability in the future. For this patient, the pelvic tilt is too low, causing an increased lumbar lordosis. Since her tendency is to stand with the pelvis shifted forward, simply applying alignment to her pelvis, shifting it back under her trunk, will bring her pelvic parameters into better harmony. Consult a scoliosis specialist when your symptoms have increased. Pain and stiffness can occur on the convex side due to eccentric contraction of elongated muscles, or at hypermobile transition points in the curve. You may need scoliosis-specific exercises instead of general exercises to focus on reducing the curve pattern that could be contributing to pain. Manual therapy can help both the concave areas, where tissue is shortened, and the convex areas, where elongated tissue has become fibrotic. Your symptoms may have increased due to disc degeneration, which can occur alongside scoliosis or be a cause of scoliosis. In either case, scoliosis-specific exercises will be important to reduce the curve pattern and address instability at the hypermobile segments before continuing with general fitness exercise. You may have comorbidities along with your scoliosis. An injury or surgery to a limb will cause imbalance and can exacerbate scoliosis, which is already placing you in a compensatory state. Addressing both issues may be necessary before continuing with general fitness exercises. You may have other comorbidities with your scoliosis, such as MS, sciatica, osteoporosis, or other neurological disorders that will need scoliosis-specific exercise before returning to general fitness exercises. If you had a fusion for your scoliosis, just like any fusion, there is a tendency for areas above and below the fusion to become hypermobile. Exercises you have done in the past could create stress on these hypermobile areas. Learn how to modify before returning to general exercise. When you have a fusion for your scoliosis, the scoliosis pattern remains. Scoliosis-specific exercises target proprioceptors in type 1 muscle fibers that can reduce the impact of the pattern on your fusion. Ultimately, a scoliosis specialist can communicate with your fitness trainer once you are ready to return to general fitness exercises. This will be helpful in order to reach your fitness and lifestyle goals. This concludes 10 tips for adults exercising with scoliosis. Thank you.